Hi everyone, welcome to my YouTube channel. Here I will be talking about the questions that are often asked in MSc Nursing programs under Rajiv Gandhi University of Health Science. I am starting with topics in medical surgical nursing, which is my specialty. So this is my first video. So please let me know your ideas and suggestions in the comments and don't forget to subscribe my channel for more videos. So let's go to the topic. Today I am discussing about one of the questions which is asked in 2020 November and also previous question paper I have seen this question. We know in Rajiv Gandhi University Health Science the questions are repeated. So let's see the questions. Explain the causes and clinical features of BPH and discuss the surgical management in BPH. So let's go in detail. So how to answer for this question? As we know, in the question itself, they have mentioned what they want. Like they want causes and clinical features of BPH and surgical management. We know every question we have to write the nursing management. So we can split like this. And we know we all are following like we are answering the questions like in same way. We are not focusing on the what they asked in the questions. So I will organize the topics on the basis of the questions. So in first we have to write an introduction. In that introduction part we can write the definition, the incidence rate, and also we can include the anatomy of these prostate. So let's see. We know what is BPH, benign prostate hyperplasia, is defined as a non-malignant enlargement of the prostate gland resulting from increase in the number of prostatic cells. This condition primarily affects men as they age, with an incidence rate that rises significantly after the age of 50. We know after the age of 50 in men, majority of men they are experience the symptoms of BPH. Studies indicate that approximately 50% of the men aged 60 and older experience symptoms of BPH, and the prevalence increases to nearby 90% by the age of 85. So we know in benign prostatic hyperplasia, in this we know the prostatic glands are situated in the both side of the urethra. So when it is enlarged, it compresses the urethra. So it will lead to the clinical features. So let's see etiology and risk factors. The exact cause of BPH is unknown. So there are few risk factors which lead to the BPH that include aging. As aging, it increases the risk of BPH. Already we mentioned in the introduction part because we know men over 50 years have the high risk of getting BPH, and also hormonal changes, increased level of dihydrotestosterone. I will mention what is this. Contributed to the prostatic growth. So and family history. We know family history is a strong factor, and obesity and sedentary lifestyle. This all it will leads to the hormonal imbalance. So it will leads to the development of BPH. Next is chronic medical conditions like diabetes, hypertension, heart diseases. These all are leads to the hormone imbalance, and thereby they will get the BPH. And diet. A diet rich in red meat and low in fruits and vegetables may increase the risk. And also race is also one of the risk factor. Higher incidence is in African American men compared to other ethnicities. So this about etiology and risk factors. So let me conclude again. We know the risk exact cause of BPH it is unknown, and the risk factors include aging, hormonal changes, family history, obesity, and sedentary lifestyle, lack of physical activity, and chronic medical conditions like diabetes, hypertension, heart disease, and also diet is one of the risk factors. And race is also, we know in African American men are more risk for the comparatively other ethnicities. Okay, so this about etiology and risk factors. Let's see pathophysiology. So pathophysiology and all you have to mention like how it lead to the clinical features. So no need to write in detail, but you should know how it occurs. Okay. So how it occurs, let's see. Due to the hormone changes and imbalance of testosterone and estrogen, level of dihydrotestosterone increases. So what is this hormone? This is a hormone. It is normally produced in men's body in order to stimulate the prostate cell. We know prostate cell which producing the seminal fluid. So this is normal in men. So when there is a imbalance of testosterone estrogen, it will lead to the increased production of dihydrotestosterone, that is DHT. Okay. So as a result, what will occur? It will lead to the prostatic enlargement. So when there is prostatic enlargement, we know the prostate is situated in two side of the urethra. So it create a mechanical pressure around the urethra. Just imagine the urethra in the mind, and when there is a pressure from both sides, it will narrow the urethral passage. As a result, increased resistance during urination, and the patient feel increased resistance during the urination. So this will lead to the clinical features. So if it is untreated, what will happen? If it is prolonged, the patient is experiencing the symptoms, it will lead to a bladder changes. Urine, it is urine will be in the bladder, and it will leads to the bladder muscle work harder to push urine in the through the narrowed urethra. So when it is the workload of the bladder increases, it will lead to the increased bladder pressure. As a result, bladder hypertrophy will occur. So it will leads to the incomplete bladder emptying. This will lead to the complication. So this about the pathophysiology. So I am concluding once more. Due to the hormonal changes of testosterone and estrogen, there will be a imbalance of the dihydrotestosterone hormone, which is a hormone necessary for the prostatic cells growth. So when there is the level of DHT increases, it will lead to the prostate enlargement. As a result of prostate enlargement, there will be a mechanical pressure around the urethra. This will lead to the obstruction, and when this obstruction continues, it will lead to a pressure in the bladder, and as a result, bladder hypertrophy will develop, and it will lead to the incomplete bladder emptying and further complication. So this about the pathophysiology. So let's see the clinical features. What are the clinical features? We know urine it is a going through a narrow passage, so it will lead to a frequent urination. Patient want to go the washroom like frequently. And the next feature is nocturia. It is the more urination in the night time. And the next is difficulty to start the urination, and the weak urine stream, because we know the urine is coming through a very narrow passage. And urgency to urinate, because the person's ability to hold the bladder capacity, it will reduce in BPH. So the urgency to urinate, it will increases, and further it will cause urinary retention. Urinary retention means urine retained in the bladder, and the patient wants to urine, but patient can't urinate. So let's see what are the complication. You have to mention only the what are the complication, just list out, no need to write in detail. We know urinary retention, that means inability to urinate, and bladder stone, because urine it is loaded in the bladder for long time, so it will lead to the bladder stone formation. Frequent urinary tract infection, UTI, bladder damage, and further kidney damage due to the back pressure. When the bladder pressure increases, it will put the pressure in the ureters also, then thereby the kidney damage will occur. And hematuria, because urine is coming through the obstructed or narrowed urethra, so there will be hematuria and overflow incontinence. And at last, overflow incontinence, leaking urine due to bladder overfilling. When the bladder is overfilled, it is automatically urine will be leaking. That is incontinence. I hope you all know the difference between incontinence and the retention. Retention means urine retained in the bladder, and incontinence just opposite to that. When the bladder capacity, it is when the bladder can't hold the urine, it will like incontinence, overflow. Okay. So next see what are the medical management. So here what we skip the diagnosis, how to diagnose. So it is no need unnecessary, and we can mention this diagnosis. It is in the nursing management section. Okay. So medical management, it include watchful waiting. That is active surveillance. That when we for the mild symptoms, that if it is not impact the quality of life, no need of any treatment, just lifestyle modification like evening the fluid, limiting the evening fluid intake and bladder training. These all are the some regular monitoring and lifestyle changes. It is only required. So let's see pharmacological management. Pharmacological management include alpha blockers. Alpha blockers, why we have to use, it relaxes the prostate and bladder muscle to improve the urine flow. For example, tamsulosin. And the second one is the 5 alpha reductase inhibitors. It reduces the prostatic size by blocking the DHT. We know the DHT about the DHT hormone. So this drug, it will block the DHT hormone. So thereby it will reduce the prostatic size. For example, dutasteride. And combination therapy using both alpha blockers and the 5 alpha reductase, we can effectively manage the symptoms. So next, let's see what are the minimally invasive procedures. First one is the transurethral microwave therapy, TUMT. It uses the microwave energy to shrink the prostate through the catheter. We are inserting a catheter through the urethra, and thereby we will give the microwave energy, and it will shrink the enlarged prostate. This one we can do in an OPD setup or daycare setup, and that's why it is called minimally invasive procedures. Okay, and the next procedure is prostatic urethral lift. Here we are using an implant, tiny implant lift, and hold the enlarged prostate tissue away from the urethra, improve and thereby improving the urine flow. Here we can see, here they used to implant in order to they will lift the enlarged prostate, and thereby it will open the urethra. Okay, so this procedure also known as urolift. Okay, and the third one is the transurethral needle ablation. Here radio frequency energy is used to destroy excess prostatic tissue, in order to destroy the excess prostatic tissue. And next, go for the surgical interventions. What are the surgical management available? We all know the common surgical treatment is the transurethral resection of the prostate, TURP. This is a common surgical treatment. We will insert a resectoscope through the urethra, and from the resectoscope we will remove the excess the enlarged prostate, and thereby relieve the obstruction. Okay, and the second one is the open or robotic prostatectomy, like open surgery. It is for very large prostates or par, all of the prostate may be surgically need to be removed. In that condition we can go for open prostatectomy. Okay, and also laser therapy. We can use the laser energy to vaporize or inculcate the prostate tissue. Okay, so this about the surgical management, and in that the common surgery is TURP. What is TURP? Here it is a transurethral resection of the prostate. Here, from the name itself, it is to understand that transurethral, through the urethra, we will insert a resectoscope. This is a resectoscope, means it is a tool inserted through the urethra to cut away the prostate tissue and relieving the pressure and improving the blood flow. So, let's go for the nursing management. How we will write the nursing management? we know first thing in as a nurse, we have to assess the patient. So, a thorough nursing assessment for the patient with benign prostate hyperplasia, it include first we have to do the history collection, patient history collection we have to collect, like duration and severity of the symptoms. For example, frequency, urgency, nocturia, weak stream. So we have to inquire about what are the symptoms patients are experiencing. Then history of any urinary retention or urinary tract infection or kidney problems before. We have to collect the previous health history and any previous treatment or medication used for the BPH and medical surg and also medical and surgical history including comorbid condition. We know when we discuss about the risk factors, we know the diabetes, hypertension, cardiovascular diseases, like all chronic conditions, it will lead to the hormone imbalance and thereby we will get the BPH. So during the history collection, we have to ask with the patient like they have any family, any history of comorbid condition, and inquire about current medication including anticoagulant, because if any surgery planning means we have to stop the use of anticoagulant and alpha blockers, 5 alpha reductors in that all using for the pharmacologically managing the BPH. So these include in the patient history collection. So as a nurse, first responsibility is history collection. Okay, in that history we have to inquire about the symptoms, and we have to inquire about the if patient experienced any complication and previous treatment, medications, medical surgical history, comorbid condition, and current medication patients using. So these are the history we should collect. In next section is physical examination. So we should observe for the inspection of signs of discomfort or bladder distension, and palpation of the bladder fullness or tenderness, and the digital rectal examination. This is one of the physical examination we are using to assess the prostatic size, consistency, or is there any nodules. So digital rectal examination, in through the rectum we will insert a finger to in order to measure the prostate size. Okay, then vital signs, uh, all sets of vital signs we have to check, and monitoring of intake and output including post void residual volume if applicable, and assessing for the complications such as hematuria, fever, pain. This we have to assess for the complications. So this include in the physical examination. So let's go for the laboratory and diagnostic test. In the laboratory and diagnostics test, urine analysis we have to do in order to look for the any infection or hematuria, and serum creatinine and blood urea energy in order to know the renal function. PSA, what is PSA? Prostate specific antigen level, because to rule out the prostate cancer. Okay, and post void residual volume measurement using bladder scan or catheterization, and also imaging technique like ultrasound. uh, we can go for the imaging technique also. So these include laboratory, and this all result we have to review, like blood test we have to review. In that blood test we have to look for the RFT, like renal function test, PSA result, and CBC, because any signs of infection we have to look for, and urine test, and we can look for the result of a ultrasound result, and also post void residual volume result. And this will we know patient need the catheterization or we can determine. Okay, so this about the nursing assessment. Okay, so after assessing the patient, we assess the patient by history collection. We all collected the history from the patient. The next we did the physical examination. Next we review the all the laboratory and diagnostic testers. So what we will do? We will plan, like we will plan our nursing diagnosis. So what are the nursing diagnosis we can expect in this condition? So patient may have the urinary symptoms. So my diagnosis is impaired urinary elimination related to prostatic enlargement. causing urethral obstruction. Okay, and next, definitely patient may have the pain because of the obstruction related to the bladder or also from the bladder distension or postoperative surgical discomfort. The next, my diagnosis is risk for the infection. We know if this kind of patient either may require urinary catheterization or surgery like TURP, prostatectomy. So there will be definitely risk for the infection. And also, we know the urine UTI, urinary tract infection, is also common. So there will be risk for the infection. Okay, and the next diagnosis will be deficient knowledge regarding the BPH management, post-operative care, and lifestyle modification. Because as a patient, they are coming to the hospital with the symptoms. They don't know anything about the BPH. They are worried only about the symptoms. So there will be deficient knowledge. So we have to give the health education for the patient. So I will discuss it later. Okay, so this is one of the nursing diagnosis from my side. Okay, you can write in your style. Okay, and risk for the fluid imbalance, so related to the surgical procedure and potential fluid retention, especially in TURP surgery, and all there will be a chances of risk for the fluid imbalance. Okay, and anxiety definitely because the patients are experiencing the pain and also concerns about the urinary symptoms and also some concerns about the sexual health, everything. So there will be anxiety. So anxiety related to the effect of surgery, concerns about the urinary function and sexual health. So these are my nursing diagnosis. So what are the next steps? So we already assess the patient and we review the lab result, everything, and we set our diagnosis. So what is the next? So the next is nursing goals. We already set the nursing diagnosis. So the next step is we have to set our goals. So for the urinary elimination, our goal will be improve the urinary function with less frequency, urgency, and the incontinence. And for the pain, a patient have to manage the post-operative pain effectively. And regarding the infection, prevent infection during surgery and recovery. And the knowledge, patient should ensure understanding of post-operative care and symptom management. And the fluid balance, maintain proper fluid and electrolyte levels. And anxiety, patient should be free from all the anxiety and the worries about the surgery, recovery, everything. So these are the our goals. Like for the elimination, patient improve the urinary function. For the pain, manage the pain as a pain effectively. And for the infection, should be free from the infection. For the knowledge, patient should attain the knowledge regarding the disease condition. And for the fluid, patient have to maintain proper fluid and electrolyte levels. And anxiety, reduce the anxiety level, uh, because we know if the patient already gain some knowledge about the disease condition, patient will definitely reduce the anxiety. So this about the nursing goals. So once already goals also we created, so what is the next step? We have to we have to set our interventions. We have to the plan of our care. So for the impaired urinary elimination, what we can do, we can monitor the urine output and assess for any signs of retention or difficulty in urinating. And we can perform the bladder scan or catheterization to measure the post-void residual urine and encourage the patient to void regularly and assist with the catheter care if necessary. And also we can administer some medications like we mentioned as ordered. Okay, and provide the bladder training technique and educate on pelvic floor exercise if applicable. So these are our interventions, and in order to improve the urinary elimination, the first thing is you have to monitor the urine output and check for any signs of retention, check for any difficulty for the urinating, and we have to perform a bladder scan in order to determine whether the patient required the catheterization. And The next is if the patient already on catheter, we can teach them about the catheter care. And the next is we can administer medication in order to reduce the symptoms. And also we can teach like patient education. In patient education we can teach bladder training technique and also pelvic floor exercises. Okay, so these are my interventions in order to improve the urinary elimination. So next we mentioned already about the nursing diagnosis, the pain. So for the pain, what we can do, we can administer the prescribed analgesics. And we can also encourage some non-pharmacologic management like relaxation, deep breathing exercise, and positioning. Okay, and assess the pain score regularly using appropriate pain scale. Okay, and provide comfort by ensuring the patient maintains a relaxed position and receive adequate rest. So these are the interventions in order to reduce the pain. Okay, include medication, pharmacological support, non-pharmacological support, pain assessment, and the promote the patient comfort. Okay, thereby we can reduce the pain. Next is risk for the infection. In the nursing diagnosis, we already mentioned that there is a patient have the risk for the infection. So we can teach the patient like we should follow the strict hand hygiene and maintain a aseptic technique when handling urinary catheter or dressing changes like after the surgery. And monitor for the signs of infection such as fever, increased redness, swelling, or purulent drain discharges. So we can teach also the patient about the like the signs of symptoms to report. Okay, and we can educate the patient about the proper catheter care and importance of hygiene to prevent the UTIs. And also we can administer in prophylactic antibiotic as prescribed. And also this is one of the important, like encourage the early mobilization in order to improve the circulation and reduce the risk of infection. So nowadays it is very important, like not immediately after, like 24 after the surgery, we have to encourage the patient to mobilize in order to reduce the risk of infection. Because when we mobilize, our circulation will be like improve, thereby it will reduce the risk of infection. So these are my interventions for the risk for the infection. So next let's see knowledge deficit, how we can manage. For the knowledge deficit, we have to give a patient education, clear and concise education about the BPH, its symptoms, its treatment options, and expected outcomes. This all we have to educate the patient. Okay, and explain the surgical procedures, postoperative care, including signs of complications to watch for. This all we can teach the patient. And teach the patient about lifestyle modification. We know this is a surgery, even the medicine, these all are giving the symptomatic relief. So the exact cause still exists. So we have to teach the patient about lifestyle modification, like reducing the caffeine, alcohol intake, diet control, and diabetic control, hypertensive action control, and exercise. This all we can lifestyle modification. We can teach the patient. Okay, use written materials, videos, and other educational tool to reinforce the learning. Provide instructions on pelvic floor exercise. Okay, these are the my interventions in order to improve the knowledge. Okay, in patient. So this about this diagnosis. So the next will be risk for fluid imbalance. So when the fluid imbalance occurs, it is like post-operatively more common. Okay, so there will be more chances of fluid imbalance during the post-operative period. So in post-operative, we monitor for the intake and output closely, especially after the surgery and irrigation during the irrigation procedures. Okay, like we know the in TURP procedure, it required the urinary irrigation. Okay, so in that condition, we have to close watch for the intake and output, and observe for the signs of fluid overload or dehydration, like edema, weight gain, dry mucous membrane. These are the signs of fluid overload or dehydration. So we have to observe for that. Okay, and adjust IV fluid as prescribed to ensure the patient receives adequate hydration, and monitor the electrolyte levels. In postoperative period, we have to monitor the sodium, potassium, and report any abnormality to the healthcare provider. These are my interventions in order to prevent the fluid imbalance. So what will be the monitoring of the intake and output, and monitor for the complication like fluid overload and dehydration. We have to look for the symptoms, and we have to adjust the IV fluid as prescribed. We should not give fluid as our wish. Okay, we should follow the physician order and monitor the electrolytes, okay, as instructed. Okay, in order to report any abnormality to the healthcare provider. Okay, so the next is anxiety. How we can reduce the anxiety in patient? We can give the emotional support, validate the patient. Can we have to hear what the patient's having, like what their concerns, and address any questions they have to about the procedure, and we should address their concerns. Okay, and encourage the relaxation techniques such as deep breathing and guided imaginary, like to reduce the stress. We can teach them some stress reduction methods, and provide reassurance that healthcare team will monitor the progress and manage any complication. We should tell the patient you don't worry, and as a healthcare team, it is a teamwork. They will monitor your disease process and progress, and is there any complication develops, we will manage. So we should reassure the patient. Okay, and offer the information about the postoperative recovery and expected timeline for the symptoms improvement. So what will be if a patient admitted and already done the surgery, and the patient don't know when they will discharge? So it will increase their anxiety. So we should instruct the patient the expected timeline for the improvement, like when they can go for the home, and when they will be back to normal life. So these all the information we can give to the patient. As this is all the nurses responsibility. Okay, so this about the nursing management. And now we discuss about the BPH, how is the incidence rate of BPH, and clinical features, pathophysiology, and etiology and risk factors, and how we can manage the condition medically as well as the surgically. And finally, we have seen the nursing management. In the nursing management, we have assessed the nursing assessment, diagnosis, goals, and interventions. So, we are confident that nurses can provide comprehensive care that enhance the patient outcomes, reduce the complication, and ensure best possible quality of life for the individuals with the BPH. So, this about this topic. So, and thank you.